Beth Gaddis, the Vice President of Marketing at Patient Prism, and I'm delighted to join Christine Paxson today here on the set. Christine is a medical dental cross-code billing specialist. She is the founder of Links to Success, a practice management consulting company. And she also sits on a number of boards and is a speaker with many different organizations, including Henry Schein, Patterson Dental, Serona Dental Systems, and many more. Welcome to the set today.
Thank you so much. I'm so excited to be here today.
Well, Christine, you and I have known each other for a very long time. And I am so excited to have you because we have so many people that have questions about this trend now going into billing dental procedures through medical insurance billing. So I want to begin with, how do you even get started? What should a doctor be thinking about to decide if this is the right decision to be making for their practice?
That's a really good question because people don't realize that there is an entire setup process. They just want to do it. Like, let's just get the form and bill. So I've put together a step-by-step setup. And if anybody comes to the courses, we're setting up prior to the course. So by the time they finish learning the medical codes and the crossover, they're ready to start billing.
Well, give us some examples. What are some things they need to be thinking about?
So for example, I have them set up for 2 companies so they could pre-authorize medical.
Okay.
And I use free services.
Oh,
I don't sell any products because it's an expense to get the people trained.
Right.
And you don't want them learning new equipment or new other things, so that's why I set them up in advance on these 2 sites. And they're able to pre-authorize, they're able to pre-verify, and they don't have to sit on the phone as much because they can do it electronically.
Oh, that's nice, really nice.
Yes, and then the final thing we do is set them up with CAQH, which is an organization which is also free that will help them send in their paperwork to whatever insurance company they will be working with. It's not about being in network with medical, it's about them knowing who you are.
Okay, so how do you start that process
So
then?
if you join CAQH, and everybody's free to go to my website, we have everything online, and they can set up their office for medical billing through CAQH. They can put their dental billing there also. So you think of it as like a virtual file cabinet where they keep all the doctor's paperwork. And so they then submit it to the insurance companies the doctor will bill. Not in network, just bill.
Right.
If you want to go in network, they could also help you with that. But just for billing purposes, they need to know who you are. They don't know who you are because we've never billed medical before.
So do you feel like every dental practice should be thinking about cross-billing for medical now, or are there specific practices or specialties that this is more designed for?
I think that the specialties are all getting on board at this point. Oral surgery, sleep apnea, temporal mandibular, and ortho.
Really?
Yes. So, because a lot of orthodontists now are treating the children, and they're treating them for sleep apnea, but without an appliance, they're doing it with an expander.
Okay, I did not realize that.
So, yeah, so it's just a really growing field, and most CPT scans, the x-ray machine, are in ortho practices more than anywhere else.
Okay.
Because they use it so much more. And now that GPs are getting in on doing some ortho, doing implants, bone grafts, having that machine is a big expense, but it's also a great way to do surgery because you're doing before diagnosing, you're doing during surgery, and then you're doing to follow up with surgery, like a medical practice would do.
So if you're getting started, so I'm a dentist and I've made the decision that I want to go ahead and start this. You mentioned that there's some staff training involved and some setup involved.
Right.
What kind of a timeline are we looking at for this?
For the setup alone is going to be about a month because they're working every day.
Right.
So the first thing I tell them is to start to collect medical insurance cards because every zip code in the United States pretty much has maybe 5 to 6 bigger insurance medical in their area. So knowing which ones you're going to be dealing with is going to help you set up better, and it's going to help me help the office learn about those plans.
Okay.
So that's about a month in involvement. And then afterwards, learning how to find a diagnostic code and how to place it with the patient. So we have to start to do better medical intake.
Right. Which team members are going to be the ones that are most involved in medical billing?
I split the work
Okay.
through the team. So the front office person who's making, getting those phone calls coming in, she's now asking 2 more questions. One is, are you taking any medication? If a patient's taking medication, they're a potential medical billing patient.
Okay.
And the second question is, who is your medical provider that is supplying you with this and his phone number? Because that becomes the referring doctor, and it also becomes a potential collaborating medical doctor who will refer a lot of patients to the office.
And what kind of referrals do you see the medical doctors might be sending to the dentist? Sleep apnea is one.
OBGYN, all
Really?
yes, OBGYN, because pregnant women are high risk.
Okay.
They get onset diabetes, they have high blood pressure issues. So prevention in the oral cavity actually lowers the pH level and keeps them healthier
Okay.
during their pregnancy.
I would not have thought of that. That's fascinating.
Yeah, so endocrinology, because of the diabetes issue we have in our country, is a very big referral. In fact, even dental plans have extra visits for patients that are diabetic, have kidney disease, are pregnant. That's how prevalent those patients are.
So I was thinking of medical code billing for dental practices as being more just like maybe implants or sleep apnea. But listening to you, it sounds like it can even just be
It's
preventive
not
care.
what work they need, it's why they need it.
Really? Okay.
So their medical history and their medical medications, and medications dry the oral cavity out.
Right.
So that alone causes a lot of decay. And there's nothing we can do about taking them off medication.
Right.
So our goal in dentistry at this point is to work along with the medical doctors as another specialist within the body.
So there's a lot more benefits than I realized to having medical coding added to a dental practice.
Absolutely. I mean, now the colleges, when I teach at Harvard or I teach, UConn is adding it, Michigan is adding it, Detroit Medical Center is adding it. They're adding medical because they know how important it is. They're teaching the young students. I mean, my son is in Virginia, graduating next year as a dentist. They collaborate on rounds with medical students. So they're graduating knowing this. So the doctors out there today, they're like a little behind because
Right.
that's not what we taught in school at that time.
Yeah, it's definitely a trend that's been coming up. Well, thank you so much for this conversation. I really appreciate it,
You're
Christine.
welcome. Thank you.
And just tell everybody, how can they find you? What's your website?
My website is links, LINKS, the number 2, success.biz. And we actually have a platform that you can join for free, and that's dentalmedicalbilling.com.
Well, thank you so much, Christine. I appreciate it.
Thank you.